Hi, everyone. Welcome back to our coffee chat. Pam and I thought it would be fun today to go through a bit of the slides that she looks at as an initial conversation and introduction to Milagro. So hopefully you can already see on our screen share the sort of tagline with which we start our conversations. And so, Pam, you and I, as we always do, will go back and forth and talk about what you're hearing in the market, how these slides land with prospects, and then I will give the implementation, customer success, post-sale impression of things.
Sure. Yeah, I think this is a good this is a kind of a good entry level conversation, I would say. So if anyone wants to like join in or look at our, decks that we use or kind of hear about our initial conversations, they have some interest in Milagro, want to know at a high level what we do, this is kind of how we start our conversation. And as Anna had mentioned, based on what the industry is seeing, but also based on what our prospects are saying. So we try to use a lot of what we know about the industry, but also what we hear and what needs are. So this is kind of based on that group of ideas.
Oh, yeah.
I know. I was like, I want to jump into this.
We both got excited about this slide.
You can go first, Anna.
So I was just going to say, it's always nice, I think, and obviously, Pam, you can speak to this more than I can, but it's always nice to sort of highlight both where Milagro fits into the process, but then also like the why now and the why us. Why is Milagro the right answer for you, the organization that is looking into figuring out how to do coding automation faster and or more effectively? For you, the hospital organization that is trying to understand how you can prevent leaving money on the table year over year with denials that get, or mismatch authorizations that get denied by payers. So I think what this slide does is really open up the conversation with the prospects, as Pam said, for this initial conversation as to why now and why Milagro.
Yes, and I think that it's really important to note that the reason why people are talking to us are reasons listed here on this slide. In order to get in front of the right people, you need to know the why, right? We need to know what's missing in our healthcare leaders like everyday role. Like where are the holes? Where are the gaps? What are they struggling with? If we don't know that, like we're talking to the wrong people, we're preaching to the choir, or we need to understand where they are, and we need to like really take a step back and kind of take a walk in their shoes to understand those things. And these are some of the things that we've gathered. The 55% coding workforce nearing retirement was something that we learned at HFMA. I mean, we know high level that kind of coders are aging out and not a lot of people are going to school to become coders. We've learned that from talking to health systems, right? They're hard roles to fill. I've always been really excited about the denials mismatch piece because I feel like I hear that over and over and over again when I talk to initial prospects. Sometimes it's on a list of things that they were audited for. And it's like, how do we tackle this? And they're tasked with it. And they hear about us and they hear about that and they're excited. So sometimes we lead with that, if that's what we're trying to solve for. We want your feedback and we learn from that too. But these are things that we have gathered along the way, and they're stats that are real. And then we talk about our product, and those are actually real numbers from customers that are using us.
This I really like.
And we're again.
So this slide, actually, I agree with Pam. This one also stuck out to me when I was walking around the various booths and vendors at HFMA. Many folks who talk about, and companies who talk about the fact that they deal with denials, and I'm using air quotes on purpose, they actually come into the process much further along than Milagro comes into the process, when in fact there is already a denial. It's almost a misnomer to say that Milagro deals with denials, because we don't. We deal with the pre-denial, right? When it's still a mismatch within the authorization of what was authorized for the surgery, what happened during the procedure, and then what was coded post-procedure. And so really, hopefully people can see my cursor. really Milagro comes in even before there is a claim and a denial, because we can code quickly enough based on the data that is produced post-surgery to alert the right teams within the revenue cycle process to be able to get on the phone, send the email, send a ping to the payers within their window of reauthorization and get that procedure reauthorized so that, in fact, it does not become a denial.
Yeah, so you make a great point. We're actually preventing the denial. So lots of companies work the denial, right? I mean, we know, and that's there's a place for that too. I mean,
Yeah.
there's definitely, when we're only in the surgical space, so we know that there's a place for that. We prevent it from happening. So what does that mean, right? That you don't even have to work that denial. So I mean, just that in itself is pretty huge. I know I had mentioned that earlier. A lot of our customers or prospects say that that's something that they struggle with, and they find ways to work around it or try to solve for it manually. We have a solution for that.
Yeah. I think Nicole, who was at our coffee chat a few weeks ago, called it building a mousetrap to try and catch the denials and the mismatch authorizations at different points within the process so that they can actually recoup as much money as possible and not leave it on the table. Or,
Right. And those payer timeframes are short for the retro auth, 24 hours for most of them, sometimes 48 if they're nice. I mean,
right.
when you're manually mousetrapping things, it's hard, So
Yeah.
we know it's a real need. We know that. And so it's great to have a solution to that. It's exciting to be able to talk to healthcare leaders and hear what they're struggling with and say, hey, we can do this for you, and then actually do it. And then have feedback from our customers now. I mean, Anna, you do a really good job of sharing like what our current customers are doing and results. And she circulates that throughout our company. It is very exciting. When we get those emails and you dig in and you look, you're like, wow, it's great. It's good stuff. So it's exciting to be able to have that to talk to your prospects about and have great referenceable customers and be able to say, hey, we do really solve a problem and it works and we have results.
Yeah, absolutely. We've talked about this a few times, both in this call and in previous coffee chats, but Milagro has two different products. The previous slide was all about our denial prevention. We also have coding automation. And with that comes the opportunity for preventing denials or really just augmenting both your coding staff and also making that whole coding process for outpatient surgeries more efficient. One of the things that I like about, we've sort of revised this slide a few times, but one of the things that I like about it is it really highlights all of the different touch points that Milagro engages with throughout the coding automation process, right? So we do outpatient surgery, that's our focus, but we do it for hospital centers, we do it for ambulatory surgery centers, we do facility billing and professional billing, if that is what the hospital would like. We use information from the CPT coding, from the HCPCS, from the ICD-10s. We take into account modifiers. So if we're coding eyes, for example, is it the left eye or the right eye? Is it the left knee or the right knee? Was there an instrument or an implant used, right? All of these things tie into our coding automation product and make for a holistic case that is coded and then passed along to either the coding team or the auditing team or directly to billing.
The other thing to mention too is that it's real time, right? So that this coding is happening quickly. It's also, the patient's like wheeled out of the OR and there's an op note that's not signed yet, but we're coding it.
Yep.
So, and it's also running in the background, which I think is important to say.
Right.
Our product is a back-end solution. It's running in the background. It's constantly looking. We know that there was a pathology. We know that there was imaging. We are looking for those results. But in the meantime, it's coding the case. It's pulled out enough out of the note from the surgeon that we can actually put the CPT codes into that case and code for it. So even if you're not talking about our denials prevention and how we can prevent those denials and those mismatches or authorize them within that window, we can real-time code your cases, which is it's fast. It's going to make a big difference for reimbursement, right? So it is, I mean, that in itself is it's revenue to the health system, right? It's revenue faster. It's really very accurate coding. So you're not having to go back and fix mistakes or things that happen in manual processes.
To show the process in which Milagro is involved and those touch points that we've been talking about where Milagro does fit into the process. So if you look at the end-to-end revenue cycle, right? Denials prevention, and I think Pam alluded to this before, denials prevention comes in very quickly in near real time, immediately post-surgery as the patient is being wheeled out. Milagro, because it is constantly searching for data, can assess whether or not what was pre-approved and then happened in the surgery is in fact what was coded. And that immediately gets sent to whoever is dealing with mismatch authorizations. With one of our customers who we've been talking to, that's their insurance verification team. With another hospital that we work with, it's their scheduling team. It really depends on who the team is that's working the mismatch authorizations and the denials. And that is the team that will then get a ping from Milagro to say, this is something that you need to focus on. This is the level of priority and urgency with which you need to address this particular case, because the payer window is by midnight day of surgery or within 24 hours, or as Pam said, some of them are very generous and give you 48 hours. So that's the initial step of Milagro involvement within the revenue cycle system. The other is, and I think Pam mentioned this as well, right? As the data starts to flow, you had a biopsy or something was sent to pathology, or you're waiting for the doctor to sign the final op note. All of that then gets taken care of during our coding automation process. And then from there, it goes, the case is coded by Milagro and then goes to billing. And then however that is dealt with, either within the EMR or with a separate team and or group. And then that gets sent off to the payer. One of the things that we mentioned when we were talking about this with Nicole a few weeks ago was that, in fact, having a more effective revenue cycle system and procedure actually makes the end result, which is the patient experience, a far smoother experience. Because what they get at the end is not a team of administrators who are at wit's end because they've just spent hours on the phone with payers who are denying their claims, and or those like non-bill bills that us patients get at the end of a procedure while we're trying to recover and try and read through what is it that we owe, and maybe it's not going to be covered, and how does that look and feel based on the experience from the hospital. And so this process is where Milagro fits in, and also where we try and smooth out any of the wrinkles within the revenue cycle for a hospital.
Also, I think it's good to note here is that we are EHR agnostic, right? So we partner with Epic. Current customers are Epic. We integrate into the Epic system. We have a partnership with them. We as the prospect talks to us, or the customer, the health system, Milagro is going to feed into their Epic workflows. Mm-hmm. So that's, I think, good to mention too, because nothing's going to change really for you. You're just going to have more information at your fingertips. Even when we talk about those retro authorizations that are time sensitive, that we might send a secured text message and a notification, it's going to go into an Epic workflow or your whatever EHR you're using. So yep. Your employees aren't going to have to learn a new system, or they're logging in and they're trying to find. No, it's very, I have to alleviate that fear off the bat too, because you can kind of see people when you're talking to them be like a little panicky, like, oh no, is this a new system I'm going to have to learn to fit into my workday? It's actually going to make your workday easier.
This is my sweet spot,
Yeah,
Pam.
this is you. I know. You go.
This is where I come in.
Yeah,
I mean, I like to talk about the whole process,
I
but this
know.
is really where I come in with alongside the delivery and implementation team. But so yeah, easy, simple integration. Once we have our VPN set up, once we've got data flowing with, to Pam's point, any of the Epic or Provision or SIS, any of the EHRs that you're using, we then integrate with that system. We start getting the data. We do a bunch of sessions to understand how the existing coding team does the coding. So what are the documents that you look at? What are the sections within the op notes that are important to you? Do you have any special payer rules that are set up with specific payers? Some hospitals even have particular doctors that have particular contracts with certain payers that change the way they can code their procedures. All of that gets taken into account and is fed into our system and built with the logic that we build on our back end. And then we spend the time doing what we call side by side. And that is when the existing coders in the hospital code the cases, our team and our system codes the cases, and we get to the end of every day and we can see whether there was any daylight between the coding. And after, on average, 2 weeks, we then decide, okay, we're seeing the numbers that we want. We've got accuracy rates that are over 95%. We've got coverage rates that are 80 to 85% of the cases within the specialty that we're coding. We're good to go. And that's when we go live. And that's when the hospitals really see the change in their work product, in the amount of time it takes to code, and the amount of time it takes to get those cases coded and then passed along to billing. And these are the results, right? So I mentioned over 95% coding accuracy on average for the specialties that we code. We mentioned before 95% reduction in the authorization mismatches that we identify. And again, to Pam's point, it's near real time. And then on average, 4 million as a potential revenue impact based on every 10,000 cases. What would be the questions, Pam, that we like to leave customers or prospects with?
Right. Well, it's questions that we kind of leave them with, but we kind of lead with also, right? Like, why are they talking to us? This is why. Like, where's your revenue leakage coming from? Can we help with that? What keeps your team up at night is a question that I mean, that's like an old school question, right? What keeps you up at night? I like it, but what something that I'd like to know before we even get this call booked.
Right.
So, and you can have it. These are conversations when you're having initial conversations. People walk up to your booth. If you get a call, if you're at an HFMA conference and someone is interested in talking to you, what do you guys do? Well, we'll tell you what we do, but like what we need to understand what they do and why they're talking to us. So that's, again, if denials and mismatch denials are a huge problem for them, that's what we're going to talk about initially.
Yep.
How we can solve for that. Yeah, I think what would success look like in 12 months from now is a good one. Anna, you have the responsibility with your team of making these health systems successful with our product. And like I had mentioned too, you share those results with us, and that's good for me. It's good for everyone to know, but it's good for me as the person who's trying to get more business, right? Or get more health systems on our product, to know that, hey, it's actually working. We have great results. We work hard for that, and your team works really hard for that. And what does that mean for you 12 months from now? We come together. We analyze a lot of their data prior to going live, and we kind of mutually agree on some results. We say, hey, we're able, with the data that you're giving us, with the surgical volumes that you're talking about, with the specialties that you'd like to focus on, we're going to be able to do X, Y, and Z for you. And then we need to deliver.
Yeah, absolutely.
So
absolutely. And I think that's a really good point, and maybe one that we can wrap up with, which is really when you put your confidence in us, and we get the data that we need, we can do a lot of the number crunching up front. We can look at your data from the past year and we can say, these are the volumes that we are seeing in these specialties, and this is the impact we can have. And I think that's a really good way of helping people with what keeps them up at night and increasing their, year over year revenue because they're leaving less on the table, and increasing their efficiency because coding automation is done faster and more effectively. And so, yeah, for all those reasons, thank you all for joining our little walkthrough of our Milagro introduction high-level slides. And we're always happy to have a conversation.
Thank you.